Case of coronavirus in Florida as testing expands across the state.
And it is the sister of the young female who traveled back from Italy.
Now at 5, we're looking to the specific symptoms doctors can now screen for and the impacts as thousands flood into Daytona Beach for Bike Week and spring break. The sister of the first female patient in Florida tested positive for COVID-19 this morning. Good evening. I'm Martha Sagowski.
And I'm Greg Wormuth. A roommate who went to Italy with the woman is also being monitored tonight. Channel 9's Lauren Seabrook joins us live here in the studio with us. Lauren, you learned people who were not able to be tested in recent weeks might be eligible to get tested now.
Right, Greg, and we've actually heard from several people who said they had all the symptoms of the coronavirus, but their doctor wouldn't test them. That's because their doctor likely wasn't able to. The testing has now expanded to anyone with lower respiratory issues, and nearly 250 people are now being monitored. 3 people in our state now have the coronavirus, but that number is expected to keep rising.
In terms of the gentleman who is in Sarasota, he was in contact with a number of healthcare professionals. You have some that have been determined medium to / high risk of transmission, others low.
The reason he was in contact with so many others is because he originally did not fit the criteria to be tested for COVID-19. And there's a limited number of tests in the U.S. At first, the CDC only wanted people tested who had recently traveled to China, Italy, Iran, or South Korea and were showing symptoms.
The end of last week, they expanded that, and that's why that individual in the hospital tested positive. So he had not qualified under that, and then now he is.
Now the CDC recommends testing anyone with lower respiratory illness. Because the Manatee County patient was already in the hospital with pneumonia, he was tested for COVID-19 when the criteria expanded. Right now, testing can only be done at labs in Tampa, Jacksonville, and Miami.
Eventually, we'd want to get those tests in the healthcare facilities. The problem is it's not going to happen overnight. I mean, I think that's, potentially months away.
The governor says he'll be asking for more state and federal dollars to increase testing and healthcare resources ahead of the expected impact this virus will have on our local economy.
So better to put the money in to do what needs to be done and to answer the needs rather than try to shortchange that.
And today, the governor also talked about the very first medical study on COVID-19 that was just released based on people who have it in China. I'm putting together a story about what it can mean for your children under the age of 15 for Eyewitness News at 6. Martha.
All right, Lauren.